Welcome to Talk with Cosmos, ma'am, hosted by Rotary Club of Contour Cosmos. Can we get started, ma'am?
Of course.
COVID has huge impact in every one of our lives. So you have been working throughout the pandemic with children. So how was that experience? What was the teachings of COVID to you, ma'am?
So COVID is a pandemic, and when we say pandemic, it means it has affected the entire world. 200 countries, over 400 million people, 10% in India, and all of us in some way or the other have been affected by the COVID pandemic. I was called to duty to work because my area of expertise is pediatrics and public health. So dealing with uncertainty, responding with the knowledge we had, the experience we had, and also the quick analysis we had to make, I think was a very critical part. So how did I survive the pandemic? Working together, thinking together, and making sure that I remembered every day what I did made a difference to the people of India, and what we did together made a difference to children and young people to whom the future belongs. Whether it's vaccination, whether it was testing and screening, whether it was taking care of families under home quarantine. I think those two things, that as a professional I make a difference, and together we make it a bit more easier for the world.
Definitely. Shanti Ashram has instrumental in tackling social issues regarding education, child health care, women, youth, and much more. We believe that such impactful service in a vast array of fields would have without a doubt shaped you with every project. Looking back at all, what is the overall impression on every impact you have made so far?
You know, our founder, Dr. Aram, referred to Shanti Ashram as a creative laboratory. There's a beautiful quote as you enter the ashram. Shanti Ashram is a creative laboratory where people's problems are studied and responded to with creative solutions. This bias towards doing something, this, I think, focus on being part of the solution, this belief that we make a difference is what has stayed with me in the pandemic, to remember that I had something to give, and something to give that was needed, but also over the decades without the pandemic, to remember that there are problems around you. And as students of psychology, you know, no matter how big the problem is, you have to start somewhere to find a solution. And I think Shanti Ashram has given me that strength. And India, with its 1.3 billion people, 44% of India are children. So every day I remember that 44% of India waits and counts on the work that we do. And therefore I think Shanti Ashram has been both a framework in the way that I work, but also because the inspiration of Shanti Ashram is Mahatma Gandhi. And Gandhiji said, Sarva Udayam, the progress of everybody. That's a timeless inspiration. To remember that what I do, what we do, allows people to be more equal. India is 1.3 billion people. We've come a long way. India is celebrating 75 years of independence, but we are still a very unequal society. When India won independence, only a fraction were above the poverty line. Today, majority are above the poverty line, but poverty still exists. And during the pandemic, more people have fallen into poverty. In fact, the World Bank says 150 million people have dropped newly into poverty. 50% are children. So this constant shaping of my mind to believe that we should be part of the solution, and the only way you can be part of a solution is when you think, when you work, when you make a difference.
The success behind Shanti Ashram is definitely one of the basic morals it has, and also the intervention that you have. So what is the Shanti Ashram system of developing an intervention, and how do you implement it successfully in the society?
Wonderful. So Shanti Ashram speaks of holistic development, like a person is a making and is a combination of everything. Like health, we define health as a state of physical, mental, social, and spiritual health. So too, when a person wants to grow, you have all these components. So Shanti Ashram has had two principles. One is to play a complementary role to government. So whatever the government does well, we support it. Education, higher education, we support it. The government dispenses primary health care. We complement it. Like vaccination now, COVID-19 vaccination. Since January of 2021, every week we've had a clinic here. We complement it by giving the last mile connectivity. So that's the principle of complementarity. But Shanti Ashram also does what the government cannot always do. Reach the most vulnerable. We find a way to get to them, the most vulnerable children. Even during the pandemic, we identified children with single parents, children with no parents, children with HIV, children with disability, and children with extreme poverty. So here is the principle of supplementarity. So you supplement, but at the end we are all working towards holistic development of an individual, a family, and a society. And that's where I think Shanti Ashram has chosen for itself education, health, and food security and nutritional security, the basic building blocks of a good life. And on this side, it has chosen to focus on women, young people, and children. So if their voice is not at the table, if their needs but also their contributions are not counted, I think it will be a wasted potential and a wasted opportunity. So Shanti Ashram both looks at the way we work, the means towards development, and it looks at sectors, and as I said, we complement the government and we also look at the needs of the most vulnerable.
That is really inspiring, ma'am. So next is the most awaiting topic, at least by me. So it is about HIV, ma'am.
Of course.
So even in today's society, HIV has its own stigma, and people who are affected by it face lots of hurdles. So how must be our perspectives be changed about them?
So let me go back to children again. And who is a child? The UN says anybody from age 0, meaning at birth, to 18 is a child. Now children historically have won many battles and come forward. In my mother's generation, mortality was the dominant experience. Not every child born lived. Because they died of disease, of hunger, of malnutrition. In my generation, thanks to the work of the previous generation, now most children born live. But is living alone enough? Isn't quality of life important? All the D's: disease, deprivation, discrimination. And this is where I think your question on HIV comes in. Now, HIV is an infectious disease. In fact, the previous pandemic in the 80s was HIV. But because it did not affect so many people, it did not spread through the respiratory mode. So the numbers were not so high. Initially we thought it was a sexually transmitted disease, and then we knew it also goes from parents to children, and then we knew that infected blood products also take it. Because the numbers were less, even though it was a pandemic, it did not evoke the same response from the world. Also, I think people were shy to speak about personal habits and practices because it was sexually transmitted. Now, having given you this background of it being a previous pandemic, I've learned a lot from I was a young medical student during the last pandemic. I finished my undergraduate studies and I was doing my postgraduate studies at Harvard University. So I learned a lot. How do you deal with the problem? What are the ways? How you titrate solutions from time to time. But I think for this pandemic, we've learned from that. So stigma and discrimination comes from a space where you don't have enough knowledge. So it's not enough if you just say that it's a discriminating experience. You must understand where it comes from. And the second thing, of course, is fear that I may get it too. So amongst the infectious disease, HIV took center stage because it was a new disease. People didn't know what was happening, and it affected immunity very much. But I first met a child in Nairobi. This little boy called Salim on a table like this. He stood up, he was 6 years, and he said, "Where were you when my mother died? Where were you when my father died? Why did you leave me alone?" So I heard Salim not just as a doctor, not just as an international student of public health. I heard it at a human level. And I came back to India and said, I want to meet with people. So it was 2001 and 2 that I first started meeting people with HIV, got trained, and from 2004 we had the first clinics with children with HIV. But at that time, every month some child or the other was dying. Today it's not the case. Last 3 years, the children who are with Shanti Ashram. We have 50 families with HIV. Not a single child has died. In fact, the first children that I treated as a medical doctor when I was active in clinical work, he's from your college, PhD College of Arts and Science, and he's now gotten into a PhD program in integrated molecular biochemistry. So, we've come a long way from mortality to morbidity to thinking of life with hope. But that stigma and discrimination still continues. And during the COVID pandemic, we took care of these families with HIV, and they had a quadruple burden. They were already affected with HIV, their health was not good, they got COVID, and they were further stigmatized. So stigma, I think, is one situation where you think beyond the real causes of the illness. You know the cause or you don't know the cause, but you have fear. And what is the best antidote to fear? Education, knowledge. Educate someone. Don't say, why do you say things like this? Use education as a positive, powerful antidote. The second thing, I think, because you're all young people and wonderful members of the Rotaract Club, don't forget the human element of working together. When you humanize a problem, when you look at it from the lens of another person, you will not see fear as the dominant emotion. You will look, at least to begin with, an openness of the mind at a human level. And I hope as interactions continue, you will be able to respect one another as equal human beings.
Definitely, ma'am. Since you have been working with children with HIV, how these people change your perspectives on life, ma'am?
I think I became, we were always taught as medical students, it's called socio-economic determinants of health. So health is not just what you have, health is also the society around and the determinants of health, like good food, good nutrition. Today we know the mind has an impact on immunity. If you feel low, your immune system gets suppressed. If you feel happy, the positive hormones come, right? The socio-economic, this is where government has a role to play. I don't know how many of you have seen, but I'm sure you will explore it during your professional, the socio-ecological model. So if you put the child at the center, the most intimate circle is their family. And the next intimate circle is the school, the teachers, the friends. Then you have doctors like me and others who come into care. And if you keep expanding it in terms of interaction, the outermost layer is the government. So my understanding by working with children with HIV is every circle of society matters. You cannot give a child a good future without working with the child's family. You also cannot give children a better future if you don't work with the government. So my perspective is working together, thinking together, so that the child gets the best of science and the best that the global world has.
What are the women and children healthcare challenges specific to India, and what are the future research scopes in that?
I think it's a very important question you ask. If I may expand it, I won't just say women, I think women and men, because we all know today that a child's general status of health, but also just a general status, is dependent on nature, meaning the genetic material that the father and the mother give to the child. It is also dependent on nurture. You are not condemned to where you're born, how you're born. You can grow and progress. Like this child with HIV who is now in PhD, he lost his father before he was born and mother a few months. But society came together, doctors came together, the scientific community came together, PhD College of Arts and Science came together to give them a future. So nature, nurture, we have to believe that things can change and we can use it together. But also remember, as students of higher education, as Rotaractors, there's another word that we speak about in the 21st century. It's called epigenetics, which is in one generation, nature and nurture comes together and it is transferred together to the next generation. So I think one of the things that I believe is that every component has to be deepened so that the child has a better future. A country like India with 44% of a children's population in the middle of the pandemic has to think, are we doing enough for children? Unfortunately, I think we are not doing enough. We have to do much more for children. And then we have to see today as a global society, not just what India produces for India's children. If America does something, if India does something, if Japan does something, if Kenya does something, it's a global world, it's a globalized world. We should be able to get the best solutions for children worldwide. And again, here is where Mahatma Gandhi's thought comes, Sarva Udaya. The map can have boundaries. The map can have geographical boundaries, but our commitment for better life and a better future for our children need not have boundaries. We can transcend it and work together.
Do you think a service mindset is predisposed? Can it be developed? And how can the young population give back to society considering financial constraints and social commitments in today's society?
I think it's a wonderful question, and I'm very happy you asked. I truly believe that everybody has goodness in them. I've been a professional now since 1993. I have never seen any human being who doesn't have goodness in them. At the right place, at the right moment, they connect with the goodness. So it is an innate gift. Vivekananda speaks about it. Everybody is innate, there is an innate potential to be divine or to be good. But I think it's, even for that innate potential to blossom, a good environment helps. That environment can be a family, but it need not be always a family. It can be, we are in Tamil Nadu and Bharatiya spoke about Periya Kudumbam. The Rotary Club is a Periya Kudumbam. You can all mutually inspire yourself, but that environment you have to be mindful. So there may be innate goodness, but it blossoms in a good environment. And I think this is where I think we elders have a very important role. Every place where we have a young person, every place where we have a child, we must be mindful that you are absorbing actively. And the third one therefore is, can you learn it? Everything can be learned. Service can be learned, positive thinking can be learned, positive psychology tells us, right? Every habit, but it has to begin in your heart and your mind. I want to do something. And for you to want to do something, it helps if you have examples. It helps if you have role models. It helps to be part of organizations like Rotary or Shanti Ashram or any of these volunteer organizations where they remind you, service before self, right? That's what Rotary tells you. So if that reminder is there, I think it can come together. So my answer is connected to the previous one. You can have an innate sense of giving back. You can be nurtured in the family, in the society, in the Periya Kudumbam. You can also learn, if you desire, to be an active agent of change, a positive contribution.
How would you want the world to remember you? What would you want to be the legacy?
You know what, when I read this question, I was like, I'm not looking back yet. I still think there's work to do. So there's a lot of work I want to do. I have a silent desire that, before I say my legs are tired and my mind cannot think anymore, that I should be able to contribute at least to a minimum 1 million children and they have better health. But if there was one way that I would like to be remembered, is to be remembered as somebody who responded to the call of duty. I am doing nothing extraordinary. This is what medicine prepared me for. This is what my postgraduate training prepared me to be a good, able and giving professional. But if there is a more beautiful way of saying it, I hope I will be remembered by someone who worked every day to give every child a healthy start to life.
Shanti Ashram is based on the principles of Gandhi. What our history books taught so much about it. So what are the essence of Gandhian principle and why did you decide to inculcate it in your life?
Mahatma Gandhi is both an inspiration for me, but he's also in some ways a part of me, a part of you. His values, Gandhiji himself said very beautifully. I'll use two of his quotes. One, he said, what I am saying is nothing new. It is as old as the mountains. It's part of this culture of India. Sarva Udayam, progress of everybody. This is part of the Indian culture. He said, all that I am doing it is I am living it. And I hope each of you will believe in that deep culture of India. So Gandhiji is one in that journey. Tomorrow it is you. Today it's me. So I think Gandhiji lives on. And I want you to remember these words, because sometimes you look at a hero from far away. For me, Gandhiji is here. And every time I do something well for children, every time I work with my team at Shanti Ashram, I said, yes, we've given a little bit more to Sarva Udayam. The other thing Gandhiji said, and I love it, I love this quote. He has very beautiful words, but one of the things that I like very much, he said, the Ganga of rights, the river Ganga, the Ganga of rights must emanate from the Himalaya of responsibilities. And I always remember that when I ask for a better teacher, when I ask for the attention of young people, when I ask young people, can we work together, my responsibility is many-fold more. Am I worthy of your love? Am I willing to work together, really? So I hope you young people, the world is an extraordinary place for you to showcase your talent. But the world is also an extraordinary place for you to find meaning and purpose in life. You are the lucky ones. The previous generation could not go to higher education the way that you are. You are the lucky ones because women are in great numbers out studying and in workforce. So I also want you young people to always remember, big things, big changes, like a poverty-free India, giving every child a healthy start to life, cannot be done in 1 or 2 years. You have to prepare your head with knowledge and updated knowledge. You have to always be in communion with your heart so that compassion never leaves you, and believe in the power of your hands so that you can keep serving. And for the next generation, I think with a head held high, you can say, I did my job. And I wish you all the very, very, very best.